dream come true. I make that.
Right, hi everybody, I'm Dragonborn, and this is the last actually surgeon things I will ever do on my channel. I am done with them. I've done plenty of them, so this is the last one. Now looking at this image, I have no idea what the foop is going on. So it's with Dr. Susie, so I'm just gonna click in and kick ass and take names. And is this cataract eye surgery?
Hello, and welcome to Surgery Squad's Cataract Surgery. I'm Dr. Susie, and I'll be guiding you through this procedure today. A cataract is a clouding of the lens inside the eye. The lens is located behind the pupil and focuses light on the retina. A cataract causes loss of vision that can't be corrected with glasses, contact
I don't want to do
lenses,
this.
or even LASIK, so it must be surgically removed. We're going to remove the clouded lens and replace it with a new one called an intraocular lens, or IOL. The surgery takes about an hour and can be done on an outpatient basis. Today, our patient is a 66-year-old woman who has noticed an increased blurriness in her vision, as well as decreased night vision.
I guess it's
She saw
left
her eye
eye.
professional, and she detected
That's
cataract
even scary.
and recommended her to us for surgery. Let's begin.
Take it.
First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put her to sleep.
I'd put her to sleep to be truthful, but that's just me. But as we know with another needle. Oh my god, you can see it going in.
Just prior to surgery, additional drops of anesthetic are applied.
Well, that's not bad. I mean, I took me out the other day. I had to get my mum to
We'll
literally
use a device called a
get
speculum
drops.
to hold the eye open wide during the procedure.
that
Place the
fucking eye
speculum
move.
for me, please.
Well, she's not allowed as she used to be.
We begin the surgery with a small, painless initial side port incision. This is called a limbocorneal incision. It's done by making a small cut in the limbus with a crescent knife.
Oh my god. Oh. Oh.
Next, we use the crescent knife to make a corneal tunnel into the interior chamber of the eye.
Oh. Oh. Oh, it's awful.
A thick, transparent viscoelastic fluid is injected to fill the space between the cataract and the delicate underside of the clear cornea in front of it. This is done to keep the cornea from collapsing during the procedure. Help me out and inject the fluid into our patient's eye.
Here we go, people. If it's screaming, look away. Oh. Fuck me, fire.
Now we need to make a 2.85 millimeter wide incision at the edge of the cornea for the cataract removal.
I'll be
This is done with an
2.854. What? I
extremely
don't
thin
know.
diamond scalpel.
Oh, that's the. Oh. Oh,
A
this is
bent
nasty.
needle is inserted into the incision and used to poke a hole into the clear sac that holds the lens with the
I've had
cataract.
chocolate in the chuffing mouth. Jesus made my mouth go sticky. Do you really want to play any more of this? Oh, really? Oh,
The needle
oh
is
Jesus
jabbed to cut a hole in the
Christ!
sac. With the incision made, we'll insert the forceps to grab the torn sac and tear a circle out of it.
Oh, it's nasty. I feel
Now
sick.
you will need to inject fluid into the incision to separate the lens from the capsule.
Are we done yet? Are we done yet?
This causes
Oh,
the
that
lens
is
capsule
nasty.
to float so that it can be rotated during the next step. We'll now perform phacoemulsification, or phaco. This is done by using ultrasound to break up the affected lens so it can be removed from the eye. To do this, we pulse and drag the device to cut across the cataracted lens.
Oh my god, I'm glad I ain't got earphones on because that'd be awful. Oh, sorry. Oh my god.
We repeat the phaco from the other direction to create 4 pieces.
It's when it opens. Watch when it opens. Watch when it opens. Oh, Jesus Christ. Oh, they're going to do it again.
The phaco is then used to suction out the pieces of the old lens. I'll need you to remove the last remaining soft cataract material out of the eye, leaving behind the clear, empty lens capsule. When you're done, inject more viscoelastic fluid into the lens capsule to keep it from collapsing.
Why is it going back and then forward in?
The flexible intraocular lens is rolled up for insertion by the assistant and placed in a soft tube. The IOL is now injected through a tube into the vacant lens
I can't
capsule.
believe this.
A probe is used to spin the lens into place. The thick fluid we added to the eye will need to be removed, and any remaining microscopic cataract fragments should be rinsed out as well. The incisions in the eye are generally self-sealing. Very rarely that we
I'd
need
rather
to add a
go
suture
blind.
to close the incision. In our patient's case, we don't need any sutures. The lens is now in place. Our patient will need someone to drive her home after cataract surgery, and she shouldn't drive until she's cleared at her follow-up appointment tomorrow. We'll prescribe medicated eye drops to use several times each day for a few weeks after the cataract surgery. And she'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses will also need to be worn to protect her eye from sunlight and other bright light as her eye recovers. You did a great job today, surgeon.
Really?
While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Have I done an effective surgery? I'll be back. I don't think I have now. We're gonna do it anyway. We'll just do it anyway for this is the very last video, obviously. So this is the last video we will ever do on Surgery Squad and any other surgery, because I've actually run out.
Welcome to Surgery Squad's virtual laparoscopic appendectomy. I'm Dr. Jeff,
Hi,
and
Jeff.
I'll be assisting you with this surgery today.
Fine by me.
An appendectomy is needed when there is a blockage between a patient's appendix and intestine. The blockage develops over time and may cause occasional pain. However, left untreated, the patient's appendix could burst, causing severe internal infection and potentially death. Today we'll be using a minimally invasive technique called laparoscopy to remove our patient's appendix.
we've done all this before. haven't we?
Laparoscopy reduces the exposure of internal organs to contaminants, shortens recovery time, and results in less post-operative scarring. Our patient is a female in her 20s that has been experiencing severe pain in her mid-abdomen, vomiting, and a mild fever. These are all common symptoms of appendicitis. Let's scrub in before this gets any worse. Our patient has already been prepped and is sedated, thanks to our dedicated nursing staff and anesthesiologist. First, we'll insert an endotracheal, or breathing tube, in the patient's mouth and into her throat to help her breathe during the operation.
That's easy enough.
Since I've already taken care of inserting a catheter into her bladder, we can move on to more important steps. Thanks to the advancements in medical technology, our patient doesn't have to be cut open to have her appendix removed. Instead, we'll strategically place special surgical instruments, called trocars, through small incisions in her abdomen to perform the surgery.
As we know.
We'll begin by making one small incision in her upper abdomen, one in her lower abdomen, and one in her navel, also known as the belly button.
Well, yeah. Oh. Well, yeah. And 3. This was not actually that bad.
You handled that like a pro. Now we need to pump carbon dioxide gas into the patient's abdomen to obtain a better look at the surgical area.
Sorry, we know this.
Next, we need to insert our laparoscopic camera through the umbilical trocar. Images from the camera are projected on our monitor to allow us to inspect our patient's abdomen and confirm that the appendix is infected.
Let's stick it in and find out, shall we?
The inflamed and swollen area you see is the patient's appendix. Our next step is to remove it before it becomes an even greater problem for our patient. The appendicular artery needs to be sealed using a diathermic instrument which uses extreme heat to cauterize the artery. The artery is then divided using scissors. So far, so good. Keep it up. The appendix now needs to be lassoed with a detachable snare.
Right.
Take the detachable snare and slide it over the appendix all the way to the base. Repeat this step 2 more times, placing 2 more loops above the first one.
Listen 2 more times.
Almost there. Now we need to remove the appendix. Use the scissors to snip between the loops. Notice that when you snip, a little pus comes out, indicating that the appendix is infected. Don't worry about it though, we'll clean up everything. To remove the appendix from the abdomen, place it into this specimen bag and pull it out through the trocar. Now onto the cleanup. We've inserted a device that sprays saline into the abdomen. Move it around so that everything gets sprayed clean. With a flick of a switch, our saline is suctioned back into the same device. Finally, we'll remove the trocars and close the incisions with a few surgical staples.
So I understand really about this. It's just I find it amazing.
Excellent work!
Just about
The
3
length
minutes.
of the inpatient care and the recovery process following an appendectomy usually varies based on the severity of the appendicitis and the person's age. Luckily, our patient is relatively young and healthy, and we caught her condition early. She should be clear to go home within a day if there are no complications.
26
After being released from the hospital, it is recommended that she limit her physical activity to help the tissues heal faster, but she will need to walk short distances several times a day to speed up the recovery process. She should make a full recovery from her appendectomy within 4 to 6 weeks since her appendix did not rupture. Had it ruptured, a full recovery may have taken up to 8 weeks. And that's an appendectomy. You did amazing. Why not try your surgical skills in another surgery here on SurgerySquad.com?
I think that's it. I think that's all I've done. 2 seconds. And I'll tell you what, this is the last one. How to cook a turkey. Same site, Surgery Squad, but it's how to cook a turkey.
Hello, and welcome to Surgery Squad's Thanksgiving special, How to Cook a Turkey. I'm Dr. Jeff, and I'll be guiding you through this delicious procedure today. Nothing helps me relax more after a challenging day in the OR than cooking a fine meal, and I especially love doing it for family and friends at a big Thanksgiving dinner. The guest of honor at any Thanksgiving dinner is the turkey. Today, we're going to show you how to prepare, cook, and carve your bird to help make this Thanksgiving and others to come delicious and memorable. Just like we do for a surgery, we have to make sure we have all the tools necessary for the procedure. Here's what I use. A roasting pan with handles and a rack, good for catching drippings as the bird bakes. Aluminum foil, a stick of butter softened at room temperature, kosher salt, freshly ground black pepper, and a meat thermometer. Before you cook your bird, you must make sure it is completely thawed in your refrigerator. Never leave a turkey out to thaw at room temperature, because that might cause bacteria to form. Our subject today is a 24-pound turkey who is nicely thawed and ready to be the big star. Can you pat the turkey dry with some paper towels as I remove the gizzards and neck from the body cavity? Great work. Let's wash up and get cooking. No matter what size bird you're working with, it's important to remember to keep it moist. If the bird is too dry, your guests might have to lie and tell you how delicious the turkey is, when they really wish they were eating a TV dinner. Here's how I prepare a turkey to keep it moist. First, rub the softened stick of butter deeply onto the turkey skin, which will make it nice and brown as it bakes.
Fast play sticking a bit. I'm actually cooking a turkey on Surgeon Simulator. I've even forgot where my actual camera is as well, so it could be anywhere on the screen. Middle, centre, well, centre is the same as middle.
Good. Next, sprinkle a generous amount of salt and pepper all over the bird for seasoning.
I am literally cooking the turkey. My mum's gonna be so proud, you know. That'll do.
Great! The bird's all seasoned up, but not quite ready for the oven. Some folks traditionally fill the cavity with their stuffing mixture. I don't, mainly because it introduces some problems. First, there's a chance that bacteria can find its way into the bird. Also, if you cook your bird to the perfect temperature, the stuffing will be too dry. It's best to bake the stuffing as a separate dish. Instead of stuffing, let's put in some aromatics, such as rosemary or sage, a stick or two of cinnamon, a whole lemon, onion sliced in half, or a handful of peeled garlic cloves. As the turkey cooks, so do these guys, and they'll release all kinds of flavors that will get right into the meat. This guy's gonna taste good. One more thing before we put it in the oven. Take a large piece of aluminum foil and form a tent over the bird. It will keep any moisture from evaporating. We'll take it off during the last 45 minutes of cooking so the bird can brown up. Ready for the oven? Okay, we've got ours preheated at 325 degrees. Generally, we'll cook a turkey at about 15 minutes per pound. Our turkey weighs 24 pounds, so multiply 15 by 24 to get 360. Then divide that by 60 to get 6 hours.
Wow. I thought actually I'd have to do some adding up.
All right, let's put the game on the TV and get ready to greet our guests.
Don't tell me that.
There's about 45 minutes left. Time to remove our foil tent and check the temperature.
Look at that majestic
Smelling
turkey.
great. There's some nice drippings in the pan for gravy. Everything seems okay, but let's see where we are with the bird's temperature. Most turkeys come with this little pop-up device that's supposed to tell you when your bird is done. Thing is, it's not always accurate. That's where you need the meat thermometer. It's going to give you the most accurate temperature. We're looking for a temperature of 161 degrees for the white meat and about 180 degrees for the dark.
50.
So it's not quite ready yet. Let's leave the foil off so the turkey can get a nice layer of browning on it. I've got to get back to my guests.
Oh, obviously.
Here he is, all nice and brown and ready for carving.
You sure? There's bird bits.
Cut here in this thin layer of skin that holds the thigh to the breast. Cut all the way down to your carving surface.
Yes, we know.
Great. Now just take your hand, washed of course, and press down on the thigh. Remove it when you hear the socket pop. Then just cut it off.
I know cooking's like, I know what it means, but that just sounds so wrong. I like that.
Put that on a separate plate to carve up later. Now let's begin carving the breast. Nice and clean. Ought to have you over to carve our Christmas turkey too. Let's cut a few more slices. These guests are getting hungry.
Yes, I know. We're on it now, I can't bon it. I have to do toe position, don't I? Stupid. Literally stupid.
Wow, those are some delicious looking slices. Great job.
I just did that
Let's just go ahead and
miraculously.
eat. See you after dinner.
Yeah, oh, don't I get some then?
Our subject is, well, gone, but everyone else is recovering nicely. They'll want to rest thoroughly to let their food digest. Guys might need to loosen their belts a few notches for comfort. Your guests may also stray into the kitchen for leftovers. That's normal and encouraged. It means less you had to clean up. You did a great job today. Thanks for your help in the kitchen. Have a wonderful Thanksgiving, and we'll see you back in the OR working on one of our other surgeries here at SurgerySquad.com.
And that's it for Surgeon Simulator, or Surgeon Squad, or whatever you want to call it. That's it, there's no more. I'm done with it. I'm done now with Surgeon Simulator, Surgeon Squad, and all surgeon crappy things. I'm not playing no more. Brings tears to my eye, you know. That's dumb. But, anyways, I had a good time being squeamish. I did. Well, I played the damn stupid thing. But, that's it. No more. And I finished off making a chuffing turkey. Thought to be a lot longer. But, I didn't. Sweet anyway. But anyway, thank you for watching. Clint 64, I have done. And as always, I will see you in the next episode. I'll just hit my chuffing microphone. Bye bye. Subscribe for more. And hit the like button for more. And share with your friends on Twitter and Facebook. And comment if you like the new outro. Every little helps. This song just makes me so happy. Everything is awesome when you're part of a team.